The pandemic has vastly exacerbated the global north-south divide, with wealthy Western states moving steadily toward herd immunity, while a majority of Africa, Asia, and Latin America wait for vaccines to trickle down. Only a small number of countries produce their own coronavirus vaccines, but the rest of the world depends on them for their immunizations. This raises the specter of a new geopolitical arrangement, one in which patron-client relationships are determined by the asymmetry in vaccine supply versus demand. To talk to us about the geopolitics around the COVID vaccines and what it means for Namibia is Minister Nandi-Ndaitwah, the Minister of International Relations and Cooperation. Very good evening to you, madam, and thank you so much for joining us.
Good evening. Thank you for inviting me.
Much obliged. Honorable Minister, what do you make of the current distribution of vaccines across the world, especially for the poorer nations?
You know, it's very unfortunate what is happening now in as far as the distribution of vaccine is concerned. For example, for us in Africa, the whole distribution is moving very slow. And to make it even worse, the prices are not the same. For the lower and middle income countries, you end up, if you have to pay, you pay more than your counterparts in the developed countries. But the whole thing is that the vaccines are just not available because even the COVID supply, which most African countries thought they would be able to get their vaccine, there's nothing really much which is coming out. And Namibia is one of the examples. We have paid our deposits, but up to now they did not supply all that we required. So if we had not received the donations which you received earlier from China and India, it was going to be very difficult for us even to reach the percentage where we are. So there is really unfair distribution of vaccine. And maybe I can say that it's a wake-up call for Africa to make sure that we build our own capacities and not to be relying just on other countries as they are taking care of themselves, and they can also use this essential commodity to meet their own even political demands. So we have really to do something seriously as a continent.
How would you say are COVID vaccines redefining diplomacy as we know it?
Diplomacy as you know it is an art or science of managing cooperation between nations in a peaceful way. Now, one really expected that during this time of COVID, when we are talking about life and death, in order to maintain our peaceful relationship, there should be fair distribution of vaccines. Unfortunately, that is not what we are experiencing. Besides that, the World Health Organization has directed that they must really have fair distribution. However, that is not what we are seeing. So it's really unfortunate that we are finding ourselves in that situation. And because of that imbalance, you find even now there's a question coming on some restriction on the travel. Because of that, Africa has not reached even the 6% of the population being vaccinated. Meanwhile, you are having other continents like the EU who are planning to have a COVID certificate, which covers COVID-19 vaccine, test and recovery that will be used for travel. But that is going to be a serious problem. So that is why even in our region, at the SADC Council of Ministers, a decision was taken that we should continue to demand that we should ask for the COVID-19 test certificate and not to go for the COVID-19 vaccine until we make sure that we have reached a required percentage of herd immunity. Because if it comes now, then it means restriction in terms of traveling. And that is not going to be good for the peaceful coexistence among nations.
Mm-hmm. Currently, COVID-19 vaccination highlights the gap between the haves and the have-nots and widens the social inequality gap. How can this theme be pushed in all international forums to galvanize support for Africa? As you rightfully said, that this is indeed a wake-up call for Africa to start looking within to find solutions to our own problems.
Yes, exactly as I said, it's a wake-up call. And one really appreciates that the countries like India and South Africa, they have mobilized or they have led a campaign which is calling for the World Trade Organization on the issue of intellectual property rights to waiver on the COVID-19 related medication, so that other standards can be established in order for vaccines to be available. And we are happy that the World Health Organization has identified some places, including South Africa, to be the World Health Organization first COVID-19 message RNA. And that will really enable us to have a technology or vaccine hub in our continent. And I believe in so doing, we'll be able to build that capacity for now and for the future. So that is very, very important for the capacity to be built.
Some argue that governments must move away from the overdependence on the precarious supply of the COVAX alliance to proactively pursue bilateral arrangements, foster public-private partnerships, and procure their own supplies by earmarking the budget. How realistic is this argument, in your opinion, and for a country like Namibia?
Yes, governments have to make concerted efforts in order to acquire their own vaccine. And in terms of manufacturing, it really needs a cooperation among nations. Particularly in Africa, we cannot think of each and every country to have its own center of producing vaccines, but has to work together as African countries. Of course, the participation of the private sector is very important. And I must tell you, we are very happy, particularly in Namibia, that our private sector has come on board. There is what is called Vaccine for Hope, which is a working association or group of the private sector, and they are working closely with us as a government. For example, the vaccine that we acquired recently from China, the transportation was paid by this private sector. And you might have also picked up that our private sector is organizing this drive-in vaccine. So that is really going to assist us to speed up the process of vaccination so that we will be able to reach the required herd immune, which is between 60 and 80%. So even in terms of now putting up the pharmaceuticals, definitely it requires a cooperation between the government and the private sector. So private-public partnership is very, very important for development in any sector of our economy, leave alone now the issue of vaccine and medication as a whole. So definitely the private sector are a major player in strengthening our capacity when it comes to taking care of our population.
Lastly, Minister, Cuba is also one of the countries that were able to produce their own vaccine. Given the history between Namibia and Cuba, one wonders why we have taken so long to procure the Cuban version of their COVID vaccine. Is there anything in the pipelines in regards to that?
No, you are right that Namibia and Cuba, we have a long historical relationship, and we will continue to strengthen that. But you have also to understand that the Cuban vaccine has just come into the market, and its distribution, they are also taking care of their population. And as we are now getting to get more vaccines that are coming into the market, definitely we will see which one will be available, and if we will still be in that position to acquire it, and also to need to make use of that vaccine. So you have to accept that the Cuban vaccine has not been there from the beginning. So it came in at this later stage. But we are very happy, and as a country, we are really congratulating Cuba to have reached that level, considering the economic blockade that they have been experiencing over the years. So we really congratulate them for that. And Namibia and Cuba will continue to work together as we have been doing over the years, even during the difficult time of our struggle, and we will continue now during the difficult time of development, and now as we are dealing with this COVID pandemic.
Madam Nandi-Ndaitwah, thank you so much for your time. It's highly appreciated.
Thank you very much. And now I'm calling on Namibians. We have now acquired the vaccine. Please be available to be vaccinated. That's the only way we'll be able to go back to normality. In the meantime, we should continue to adhere to all COVID protocols so that we can really bring back our normal situation and continue to develop our country. Thank you very much.
Thank you so much, ma'am. And that was Nandi-Ndaitwah, the Deputy Prime Minister and the Minister of International Relations and Cooperation, talking to us about the COVID vaccines and the geopolitics surrounding it and what it means for Namibia, and also at the end, they're encouraging Namibians to go out and get vaccinated.